As Massachusetts remains in the middle of the expected surge in COVID-19 cases, hospitals are doing their best to care for patients and ensure that they have the personal protective equipment they need for staff. Tonight, we hear from Joanne Marqusee, the president and CEO of Cooley Dickinson Hospital in Northampton. She spoke with Connecting Point's Carolee McGrath recently and gives us the latest on the response to the pandemic in Hampshire County.
So we have about 12 to 15 patients on any given day in the hospital with COVID. I don't have the numbers offhand of how many in total we've treated. Many of them are in the ICU. Many of them are vented, so they are quite sick patients. But we've certainly discharged a number and are doing fine in terms of being able to care for them. The general volume at the hospital is way down because of all of the stopping of elective procedures and all the things that people aren't coming in for. So at this point, Cooley is well positioned to care for those patients.
So there's plenty of beds at Cooley Dickinson?
At this point, yes, there's plenty of beds. And we've also, in order to be able to accommodate any significant increase, we already are able to care for about twice as many patients as we usually would care for, and that includes about 3 times as many ICU patients. So we're feeling like our surge capacity is quite good to accommodate the demand.
Tell me a little bit about the testing that you're able to do now and how that has changed since the beginning of this.
At the beginning, testing was extremely limited, and there's a lot of different resources you need to be able to test. So it's not you have to make sure you have enough of each of those. So that includes the actual supplies to do the test. It includes the lab capacity, includes what we call viral transport media, which is the what you use to actually transport a lab specimen to another lab. And then you have to have the personal protective equipment for the staff to do the testing. So it was fairly limited at the beginning, but as each day goes by, we're able to expand our testing capacity. And in fact, last week we expanded our drive-through testing capacity. So we have sort of more lanes and more staff so we can test more people at the same time. And as of today, given that capacity and our ability to do more tests and have the supplies, we have expanded our criteria for who gets tested. So now, as of today, anybody who is symptomatic and has been referred by their primary care provider will be able to be tested, whereas in the past, we were limiting it based on criteria of how sick you were or what your comorbidities or your risk were. Obviously, we're also testing our inpatients, and as of today, we're now testing all inpatients rather than those who just seem clear to have symptoms, and that includes all of our OB patients.
Tell me a little bit about how you advise people in this situation if they do feel like they have symptoms who live in Hampshire County.
So the first thing is to definitely reach out to your primary care provider. If you don't have a primary care provider, you can call our COVID call center, and we will absolutely link you up with a primary care provider, and they will determine whether it's worth it for you to get tested or if it's better for you to stay at home so you're preventing being exposed to more people and exposing more people, and that depends on the symptoms. I am starting to get worried that people are taking so seriously the request to not use the healthcare system if you don't need it. For example, don't come to the emergency department if you don't need to, and maybe aren't reaching out when they really should and need to. We have plenty of providers and staff to answer calls, to do visits, whether on the telephone or even by video. And we have seen anecdotally some patients show up at our emergency department who really would have been good for them to come a few days earlier, and so they are now sicker. So I just want to get the message out that we are open in business, even if that is virtual, and it's not good for people to suffer at home.
And I think a lot of people are afraid to reach out or to walk in, of course, to an emergency room in this environment.
Yes, and we want them not to come to the emergency room without talking to their primary care provider unless it's really emergent, but don't hesitate to reach out to talk to your physicians.
Tell me a little bit about where you stand as far as personal protective equipment.
So this was definitely a big concern at the beginning of the epidemic, but over the last several weeks, there's been amazing work done to both increase the amount of personal protective equipment. We're certainly using more than we've ever used before, but right now we feel we're in reasonable shape. Every day we monitor how much we have of each of the different kinds of PPE, and to identify where the potential shortages are. So masks were a big issue in the past, particularly now given that the partners and this company called Battelle are doing decontamination of N95 masks. That's better. Today, we're a little concerned about gowns, so we're working to make sure we're doing all we can to conserve the gowns, but we're okay for now. And we have a much stronger level of confidence than we did a couple of weeks ago that we'll be okay through this.
So hospitals obviously are taking a huge financial hit across the country. Just explain a little bit, if you could, about how this has affected the bottom line.
It is significant. There are two buckets, if you will, of financial impact. There's the extra expense. So whether it's using many, many, many more supplies than we've ever used, there's also the fact that we are training all sorts of staff so that they can, for example, OR staff can work in the ICU. We're bringing on additional staff, particularly in the ICU. So significant expenses, but there's also the lost revenue because of the decision to not have elective procedures and to encourage people to stay home and not come for care right now unless it's really needed. So the financial impact is in the millions per week for even a hospital that isn't that large like Cooley. So you can imagine for the hospitals across the state and the country. We are grateful for some of the assistance we're starting to see from the state and the federal government, but I want to be realistic that what we've seen to date and know about to date might cover a couple of weeks of our losses, whereas obviously we're going to be into this for several months. So we are continuing to advocate strongly through our associations and with our legislators about the importance for all hospitals to have a significant flow of dollars from the federal government to assure that hospitals can provide care today and that we can continue to do that in the future.
Tell me a little bit about the radiothon that you took part in last week.
So we had a number of local donors, and the community in general has been incredibly supportive, whether that's donating supplies or donating food for our staff who are working so hard during this, but also very much wanting to support us financially and recognizing both their gratitude for what we're doing, but also the reality of this financial impact. So a number of donors came to us and offered a challenge grant and suggested that we do this radiothon. The radio station were fabulous. They stepped right up, said absolutely, we'd do it for the day. And so we have raised over $150,000 for the COVID emergency fund already. And what's really gratifying is the notes we get from people about what it means to them to be able to give and support us at this time. So we really appreciate it. We obviously are very aware that everybody is struggling financially. So the fact that people are digging deep into their pockets at this time to support their local hospital means everything to us as an organization, and it means a tremendous amount to our staff.
You know, a lot of people obviously are feeling a lot of anxiety, because of COVID-19. And I think one of the issues that comes up is if, a loved one is in the hospital, whether it would be for COVID-19 or for another emergency, you can't be with them. And that really doesn't sit well, of course, with anybody. Everybody understands why, but that has become a big issue. Tell us a little bit about how you're dealing with that at Cooley Dickinson.
So definitely limiting visitors like that was a very hard decision, because we know this is not just like, oh, you're not going out to dinner with your friend. This is limiting people's ability to be with their loved one at the time when they need them most. So right now our policy is virtually to have no visitors because of our desire to reduce the spread and the use of PPE. The exceptions are in childbirth center. We allow one visitor. It's a little bit more than a visitor. It's a partner partner there to be with you. And then on the floors, we will take exceptions, requests for exceptions. For example, if somebody is at end of life, we'll allow a loved one to come in. If somebody isn't able to advocate or explain what they need or understand what the providers and staff are saying to them. So we do have some exceptions, but they're pretty limited. In order to try to make up for this, first of all, the staff are doing an amazing job at just being there even more for the patients and recognizing that they're somewhat making up for the lack of a loved one there. But we also have provided iPads to all inpatients who can use them. And that was really appreciated by those patients who were able to use them.
And that has to be a lot of pressure on the staff. I'm sure every day that's what they're doing. They're there at the bedside caring for people, but now they're kind of in the place of the family member. How's the staff handling this?
Well, I think our staff has been unbelievable. They're dealing with the stress of caring for these patients, both what you said in terms of the making up for the lack of the family members being there or other loved ones. And they're also treating some very sick patients and having to constantly use a lot more PPE than they would typically use. And all of that adds stress, adds time to what it takes to care for the patients. But they have been incredible, not only in just continuing to care for the patients, and we get notes all the time about people saying they could feel the smiles even though they couldn't see them through the mask. And so really trying to not just give the clinical care, but even more than ever, be there for people emotionally and give them that comfort. They've also been really flexible. We've moved staff around to go to units that they haven't been to before, that they've gotten trained for, having to use new computer systems, working with new teams. We have people who typically work just days who are now working nights in the ICU to help provide staff there. So really, people have been amazing. I do worry all the time about burnout and just the fatigue. And so we're trying to do all we can to, first of all, make sure that people are getting some breaks and getting some time off, but also that we're making available to them all sorts of resources for employee assistance, counseling, all those things that really can help them get through this. Employees who want to can stay in a hotel occasionally at our expense in order to be able to, after a really tough shift, if they feel like they don't want to go home, to have that break, or if they live far away and they have to be back early the next day. So we are trying to do all that. We certainly hope that our program, which is not doing any layoffs or any reductions in pay, and for people to know that they don't have to worry that if their particular category of the job is not needed right now, lots of people are working at home, but for those who can't, that they continue to get paid. And we hope that also gives them some comfort in this difficult time.
How do you feel that Hampshire County is faring compared to the rest of Massachusetts, or certainly Western Massachusetts? I know the numbers are certainly lower.
Yeah, the numbers are definitely better than what was predicted a couple of weeks ago. And I think that is at least in part attributable to the community doing a terrific job at taking the social distancing, the hand hygiene, all of those things very seriously. We also have an advantage in being not a particularly dense population. It's certainly more challenging in a very urban area. We're very aware that in many areas of the country, we have seen a disproportionate impact on people of color. And people who are in marginalized communities, and we're watching our data carefully to see if we see that, and trying to make sure that we're translating all our materials and getting to all the populations. Having said that, I worry that the lower numbers are going to give people a false sense of security. And so just really, really implore people to continue to do what they've done. If they haven't been 100% on board with wearing masks and all of the other social distancing, that they really take this seriously and do that, because we could fall backward very quickly and still see a very large surge if we really don't continue to follow all those best practices.